Welcome to the Her Vibe is Pretty podcast, where you'll be guided on how to step up into your evolved woman,
design your dream life, and start living it. Let's get vibey.
What's up, loves? Welcome back to the Her Vibe is Pretty podcast. Today we have a very special guest who came on to the show. So much goodness is in this episode, but before we get going, you guys have been asking for it since pretty much we started the show, which at this point in time is a little over a year. It's actually been about a year and 4 months. You guys have been asking for breath work, and you've been asking for it because Mary and I have been very open about our individual journeys with breath work, how it has completely changed our lives, how it helps us with our everyday lives feel more peaceful, at ease, free, expansive, how it helps us out of funks, how it helps us get unstuck in life, how it helps teach us new things about ourselves and our journeys. Breathwork is hands down the most powerful modality that Mary and I have ever experienced in our lives. And so I have finally delivered, and I have put together an 8-week breathwork course just for you. I had you guys in mind as I created this course because I want you guys to experience the deep fulfillment, expansion, and freedom that comes through a consistent breathwork practice. When I first got into breathwork, I was doing one meditative session every single week, which is really what helped me shift things. So just like with water, we don't just take one sip of water in the morning and then never touch it again, right? We have to continuously drink water throughout the day and throughout the week. Same thing with food. We don't just eat one bite of food in the morning and then call it good. Same with movement. We don't just go to the gym one time and say, all right, that's good. We got to stay devoted. And same thing with breathwork. If you really want to feel the deep shifts and changes that Mary and I have both experienced, as well as all of my peers and everybody who I know who has gone through breathwork themselves, you have to devote yourself for a certain period of time. And 8 weeks is the perfect amount of time for you to finally experience what we've been talking about all along and create your own transformations and have your own breathwork journey and own breathwork story. So Breathe Free is still open for enrollment until Tuesday. So today is July 14th. We start Breathe Free on July 20th. Now, if you're listening to this episode on a later date, that's fine. Head to my website, sarahjeanharkin.com. You can purchase the recordings. But if you are listening to this live, make sure you get in now, because the bonus of being there live is that you'll have a Facebook group, a Facebook community with everybody else who's in Breathe Free that you can connect with, interact with. Maybe you'll make new friends. And obviously, if you can show up to the calls, we're doing them every Tuesday night. It's going to be 6 p.m. Eastern Standard Time. That's for US and Canada. And not everybody's going to be able to make those times, and that's okay. But if you can show up live, do it, because that live portal is going to be so transformative. But even if you can only get to the recordings, that's fine too. You'll still notice so much benefit from this course. But it's really going to help you unlock and access deep parts of you and your system and beliefs and generational trauma and all of these stuck emotions in your body. You're going to be able to access that and bring it to surface. You're going to be able to release the things that are no longer serving you, that are holding you back from becoming your evolved self, your highest, best self. You're going to discover things that the mind would never be able to discover without breathwork. You are not going to regret joining this course. So head to my website, sarahjeanharkin.com/breathe-free. Enroll now, and I will see you all on Tuesday. I am beyond excited for this. All right, so now I'm so excited to introduce our guest, Dr. Jennifer Buchner, one of my very near and dear Instagram friends, soon to be real life friends. Jennifer is a naturopathic doctor who focuses on women's health. She's super passionate about helping women heal naturally so that they can love their bodies and their lives again, which you will be able to hear and feel through this episode today. Dr. Jennifer helps her patients heal by addressing their underlying imbalances in their minds, bodies, and spirits. So she doesn't just work on a mindset level or a body level. She doesn't just look at stats of tests. She works with your mind, body, and soul to help you heal. And she does this while striving to educate and empower women to become their own health advocate. It is Dr. Jenny's mission to help women create a positive relationship with their bodies so that they can have easier periods, better sex, and an amazing life. Wow. So, you guys get ready for an amazing episode. You're going to learn so much from Dr. Jenny. She's just so awesome. And who doesn't want easier periods, better sex, and an amazing life? All right, let's go to the show. All right, let's get into this interview. Dr. Jenny, thank you so much for coming on to our show.
Yeah, thank you so much for having me. I am excited.
Yay, we are so happy to have you here. You guys, Dr. Jenny and I are actually Insta friends. We real friends coming soon. But we connected on Instagram because when I was going through my health journey, our listeners, Jen, they know a lot about what I went through with the missing period and the acne. When I was going through all of that, I came across Dr. Jenny's Instagram page, which is amazing. You guys have to follow her. And yeah, we just kind of connected through there and we vibe on a lot of the same stuff: hormones, periods, body image, sex, all the things that are not really like talked about in our society today. I feel like it's becoming more and more of a thing to talk about these things, but they're really, really important topics, I feel like, for our health and well-being. So Dr. Jenny is here today to give us all of the goodness on all of these topics. So why don't you, Jen, just tell our listeners a little bit about yourself, like where you're from, how you got into all of this, whatever you feel like sharing.
Yeah, absolutely. So, something you should know about me is I just love talking about the juicy shit that nobody loves to talk about. So, I'm happy to be here and talk about anything that is considered awkward or taboo. Bring it on. I grew up on the east side of Michigan. It's about 30 miles east of Flint in the middle of nowhere. Went to school at Saginaw Valley and then went outside Chicago to get my naturopathic medical degree. About a year before I started medical school, I had no idea what a naturopathic doctor was. It was recommended to me by a mentor to check it out because he knew I was interested in health and wellness and wanted to be a doctor, but didn't feel super great about going to MD or DO school just because of the current curriculum. So he recommended that. And, within a week of him pointing that out to me, I was enrolled in school and I was ready to go 6 months later. Wow. So it was kind of a little bit of divine intervention there. And once I got there, I felt very at home. The things that I was learning were everything that I was excited about. And from moving forward through school and then afterwards, I've kind of taken it upon myself to learn more about women's health, specifically hormones. And then I just kind of recently became super passionate about sexual wellness and all of the other stuff that nobody likes to talk about. So
Cool.
That's kind of why I'm here.
Love it. So what was it that so these are this is the same question, but two different topics kind of. I want to know what was it that was really intriguing to you about the naturopathic route and the holistic route, and why? Do you have any experiences that you had yourself that kind of pushed you in that direction? I want to know how you got into that, and then why women's health.
Yeah, absolutely. There's usually a story behind that kind of stuff. I don't really have a personal story as to why I got into naturopathic medicine. Although I did grow up with my mom as an ER nurse. And so I was fairly immersed in the conventional medicine world and have the utmost respect for conventional providers still to this day. I really like my patients to keep a good relationship with that side of medicine as well. It just didn't really vibe, for lack of better terms, with the principles that I had and the way that I wanted to treat people. I also saw my dad have a heart attack at 42 and got put on 12 different medications, was never talked to about the 2 liter of diet Mountain Dew he was drinking every day and the 80 hours of work he was doing. He was stressed out and had a heart attack, but nobody talked to him about that. So I thought there was something wrong with that. And it's not anything wrong with the provider, it's the system that they're in. So I didn't even know there was another option until that mentor of mine really brought it up. And I was like, hell yes, this resonates on so many levels with me. And like I said, when I got there, I was like, yep, this is what I'm supposed to be doing. It is not a well-traveled path. Not a lot of people go down it, at least in the Midwest. So it's kind of trailblazing at this point, but I love it. And then as far as the women's health piece, I did have my own experience with that. I was on the birth control pill for about 6 years. started having a lot of negative reactions to it after about 5 years on it, which isn't super uncommon now that I know that. Switched to the IUD because I thought it was a better option. And unfortunately for me, it was not a better option. So I started having a lot of complications, and the OBGYN I was seeing just really did not listen to me and made me feel awful, honestly. Like, I remember I was in her office and she was like, yeah, all of these symptoms have nothing to do with your medication or your IUD or anything. If you just stopped eating carbs, you'd lose weight and you wouldn't be fat. And I was like, okay, go fuck yourself.
Yeah.
So I mean, that was kind of like, I walked out of that office and I was like, you know what? If I can serve women just a little bit better than this woman just served me, like, I will feel so good about where I'm going with my career.
Wow.
And then the whole sex thing has just been another big part of my life that's transitioned a lot, and I'm sure we'll probably get into that. But there's been some new reasons why I'm more excited about that lately. But yeah.
I have the chills all over my body. Like, those stories are amazing. And I can relate to you on the whole OBGYN thing. I had the same experience, and I don't know if you know this story yet or not, but I was on birth control for, I don't know, like 12 years, 11 or 12, maybe a little bit less than that. But anyway, I was on it for a long time, and I came off, and my period was missing for like 2 years. And I saw multiple doctors in the Western, conventional medicine field, and one of them being an OBGYN. And I had the same kind of experience. This OBGYN told me that there's nothing that they can do about it, that all my hormone levels look fine, the tests look great, and I just need to go back on birth control to make myself start having a period again. She was pushing that, and I was like, okay, but because she's like, you don't want to have kids yet, right? And I said, no, not yet, but eventually I want to. She's like, okay, well, just go back on the pill. That's the only thing that you can do. And I'm like, okay, well, what happens when 10 years down the road I do want to have kids, and then I come off the pill and I'm missing my period and I'm not ovulating and all of this stuff is happening? And she didn't really have anything to say. She was like, well, that's the only thing that we can do for you. I was like, okay, well, the same thing. I was like, fuck you. And I said it more respectfully. I'm like, goodbye. I'm not coming back here. And then that's when I like started my journey as well. So that's really, really cool and very heartwarming that you feel so passionately about all of this and helping women, like, really, what would you say, like, learn their bodies and like explore the root causes. That's what you help people do, correct?
Yeah, hell yeah. I am all about education and women knowing how their bodies are supposed to work, so that when something goes wrong, they know and they can advocate for themselves. Because it took me until I got to medical school to understand how my reproductive system worked. I tested out of health class in high school, if that tells you anything. Like, that was how basic it was. I never learned anything about female anatomy, female pleasure, cycles, periods, anything. And you didn't talk about it.
Right.
So we shouldn't have to go to medical school to learn how our bodies work. So that stuff lights me on fire. I can't tell. I've taught a couple like sex ed classes to, a couple different communities. That's been really exciting to just teach women, how your cycle works and how to know if there's something wrong and what you can do about it. And it should be said that I think there is a perfect time and a place for conventional medicine, for birth control, for all of these other options. I don't want to sit here and bash on that, because there is absolutely a time and a place. And, I might need that tomorrow. I don't know.
Yeah.
But we do deserve to know that there are other options, and you don't have to be miserable. You don't have to not have a period or have hormonal acne or all these other things. Like, you deserve so much more.
Totally. The one thing that I think of when you're speaking is the thing that makes me cringe the most is when I hear females say, I hate my period. When they're like, I hate my period. And I just cringe. My whole body like contracts, because I used to be that person. First of all, I absolutely used to be that person. My doctor told me I could skip periods with my birth control pills, and I would, because I hated my period. And now when I hear somebody say it, I cringe. And I have like this little motto, and it's, if you don't love your period, then something's wrong. Not necessarily like wrong. I don't love the connotation of wrong. I don't like wronging people, but like, if you don't love your period, then you don't maybe know enough about the power of the female body.
Yeah, absolutely. Periods don't have to be painful. They don't have to be miserable. You might not feel your best that's fine. But you shouldn't be, staying home from work or from school. You shouldn't be miserable. You shouldn't be biting your partner's head off. If those things are happening to you, there's something going on, and it's not necessarily wrong. It's just something to investigate. And
Right.
slapping the pill over that is like slapping a Band-Aid over a bullet wound. Like it doesn't do anything. It just prolongs the issue. And then like you brought up earlier, 10 years down the road when you want to have kids, what if you come off the pill and you don't start ovulating right away? Because you're not ovulating on the pill. People don't know that at this point. Let's get that shit out of the water. It takes a while to transition off of birth control. And I don't think a lot of people understand that. And there's so many people struggling with infertility right now. It's such a painful topic that, we at least need to discuss the risks associated with going on birth control.
Totally.
And it depends on the person, really.
Right. So one of your social media posts, I have a couple of your posts to ask you about because they're so good. One of them, you were saying something along the lines like, if you have painful periods, here are some things that you can do. And you went on to talk about like food and alcohol and movement and pooping and stress levels. Like, to somebody who doesn't already know that all these things go hand in hand, like, can you just speak to that a little bit? Because I feel like, and once again, I actually know this because I used to be this person. I used to be, when I was struggling with the acne and the periods, I would be told, not by my doctors, not by my dermatologist, but like there would be other little voices, actually like my parents, which is funny because they were never into holistic health, them. And then like a couple other articles, I would see like, oh, you should stop eating dairy, you should stop eating chocolate, you should stop eating or drinking alcohol, and your symptoms will clear up. And old me, who was like just solely listening to dermatologists and doctors, was like, these people are crazy. Like what I'm eating and what I'm drinking has nothing to do with my face. Tell me why that is like so off.
Good question. So it is sometimes hard to think about how what you're eating or what you're drinking or your stress level is impacting the rest of your body. But, usually with something like acne, I tell patients like your face and your skin are a reflection of your inner landscape. So if you're feeding your body foods that it doesn't like, you are drinking alcohol that's inflammatory and your body doesn't like it, things are going to start showing up on your skin, and you're going to be causing, levels of inflammation to rise in your body, which is going to in turn cause you to have a painful period. So, important things to consider if you're having painful periods or you're having hormonal acne is, potentially removing some of the foods or beverages or, products that could be causing harm in your own body. And one thing that I hate is restricting people on what to eat. I never, ever want to make people feel restricted because I work with a lot of women who have, kind of low key eating disorders or who have struggled through them, myself being one of them.
Yeah.
So I never want to place restrictions on people, but I do have them sometimes do a trial. Like, just try and cut out dairy for a month and see what your skin looks like. If that's impacting you at all, then you can make an informed choice. So if you want to eat the pizza, you want to eat the cheese, you're going to get a couple zits. That's why I have this on my face right now. It's because I ate ice cream this weekend, but I enjoyed it. It was delicious. I mean, the thing with, moving and pooping and all of that stuff is incredibly important because our bodies have a detoxification system. So detox has been kind of this like fad word lately, but we do have organs of detoxification and elimination. They are our liver, our digestive tract, and our kidneys. The only way that we get rid of excess hormones is through our digestive tract, through our stool, and slightly through our urine. So if you're not pooping every single day, you are reabsorbing hormones in your gut that are not meant to be reabsorbed. Our liver makes them even more of a powerful metabolite when it goes through the liver. So you're stuck with this stuff in your gut that's like super estrogen, super testosterone, whatever you want to call it. And we reabsorb it. And then we wonder why we're a hormonal nightmare or like super bitchy before our period or, get acne. These things start to add up.
Yeah.
This causes a whole nother bag of worms as far as our our endocrine system, and we can get into that if you want to, but these things are important and nobody really talks about it. And it seems simple, but even something simple like not drinking alcohol a week before your period can make a world of difference in some people.
Wow, that is so cool. So I'm just thinking about, so obviously acne is a sign of a hormone imbalance, and so are painful periods. What are some other, like, so for a listener who maybe they don't have a painful period or acne, are there any other things, any other symptoms that could indicate that a hormone imbalance is active in your system?
Yeah, there's a lot of things that can be happening there. I will say acne does often have a gut component as well.
Mm-hmm.
But there can absolutely be hormonal acne, and it tends to have a little bit more cyclical and different patterns on the face itself.
Mm-hmm.
But as far as other symptoms, I find a lot of women, their chief complaint is that they just don't feel like themselves. And
Mm,
to me, I'm like, what does that mean? Like,
yeah.
you're living in your body right now and you don't feel like yourself. Like, let's dive into that. And a lot of the times, it's happening a little bit later in their cycle. Their hormones are kind of crashing too soon or in a way that's not productive for them. And they just start feeling off. They start getting irritable. They start, lashing out at their partners or their kids, or not even being angry, but just being, snappy, irritable, not enjoying the same things that they used to, loss of sex drive. Like, to me, that's a big one.
Mm-hmm.
Everybody should be having sex if they want to, and you should want to for the most part. So that's a big one. So libido changes, mood changes, even things like anxiety and depression can have a hormonal component.
Mm-hmm.
Irregular cycles, so periods that are longer or shorter than plus or minus 5 days is okay sometimes.
Mm-hmm.
But if you're going like 40 days sometimes, 20 days sometimes, that to me is a big red flag.
Yeah.
There's a lot, honestly. So many things can be linked back to your hormones, so sometimes it's hard. Sometimes you go to multiple providers before somebody will even consider that it could be hormonal, because there are other factors at play.
Yeah. And everything that you just said too, I feel like so much of that is normalized.
Normal, yeah, just because it's common does not mean it's normal.
Right.
We're under this misconception that like periods, oh, it's normal to have really bad cramps, it's normal to like want to eat a pint of ice cream the day before my period, it's normal to be super angry or irritable. Like, no, it's common, but that doesn't mean it's normal. That doesn't mean it has to be your normal.
Totally.
Investigate it.
Right. Exactly. Oh, I love that. So something else that's coming up, and I'm asked this all the time, and I'm curious just to hear your take on it, is birth control. We all know that birth control, at least in the United States, we have a lot of international listeners, and I'm not 100% sure how this goes in other countries, but in the United States, birth control is kind of just like that thing that you do, right? It's like you just, okay, go on the pill when you're 13, 14, 15, 16, whatever it is. For the most part, I would say that that's just like something that it's almost like your induction into womanhood. That's kind of what it seems like. And for me personally, and I guess like I don't really, I'm not like super sciencey. I'm more so like, I'm going to, intuitive, and I'm going to listen to my body and I'm going to feel into these things. But I feel that birth control kind of messed me up a bit. And so I'm very like, for me personally, in my experience, I'm like, hell no to birth control. That's nothing. None of that is going to go back in my system. I personally do the, like the tracking, like I'll track when I'm ovulating, and that's my form of birth control. Truly.
Mm-hmm.
I want to hear like, what's your take on birth control, on the pill, on the IUD, and what are some options for people for birth control, and how to prevent pregnancy if they don't want to get pregnant yet without added hormones?
That is a big topic to unpack.
Let's unpack it, because literally in my DMs, like, because our listeners and my Instagram followers, they know my story with birth control and the gut and the hormones and the missing period and the acne. And I'm always asked, well, what do you do for birth control? If you don't mind me asking, what do you do for birth control? Okay, well, I want to go off birth control. It feels really good to go off birth control, but I don't want to get pregnant.
Yeah, that's fair. We are very scared of pregnancy. I'm very scared of pregnancy. That's totally fair. If you're not at the right point in your life, like, if you want to prevent that, then there are other ways. So something you said reminded me, it's kind of like this induction into womanhood or whatever to go on the pill. My 12-year-old cousin asked my aunt if she could go on birth control pills because all of her friends are on them and she feels left out. And I'm like,
oh no.
No. She hasn't even gotten her period yet, and she's already asking about that. And I'm like, oh, sweet, sweet baby, please don't go on that yet. I should make this known. I'm not anti-birth control. I am pro whatever makes you happy, whatever makes you feel safe, and whatever works best for your own body. So birth control may work just fine for a very large percentage of women. I was not one of them, unfortunately. And I see a lot of women in my practice that it doesn't work well for. So you really have to find out what works best for you. I will say the contraceptive piece of birth control, that's what it's great at. It's great at preventing pregnancy, but it's not great at fixing, the rest of your hormonal problems. It just, again, puts a Band-Aid over them.
Yeah.
So that's, my struggle with birth control is that it's marketed to be a lot more than it actually is.
Mm-hmm.
Kind of this catch-all, like, oh, you have acne, go on the pill. Oh, you have mood swings, go on the pill. Oh, you have heavy bleeding, go on the pill. But why are you having those things?
Right.
What's happening in your body to cause you to have those symptoms?
Mm-hmm.
And how are those going to be impacted by you going on a synthetic dose of hormones? So, we go on this pill and then we're told it's going to solve all of our problems, but, women aren't meant to have a steady dose of two hormones every single day. We're supposed to have different hormones present in different quantities throughout different times of the month. That's the beauty of being a female. And, with the pill, you're suppressing ovulation, which is the main event of the cycle. It's the reason why we create progesterone. And, if you're suppressing that ovulation, then you're not getting a real period. So your pill period isn't actually a real period. It's just a withdrawal bleed because you're no longer getting those hormones. And yeah, it just unleashes a whole host of other problems. So I think the birth control pill can be a great option. I caution women to go on it too young. If you are 12, 14 years old, your cycle is not going to be regular regardless.
Mm-hmm.
There's going to be some irregularities. That's just part of your body figuring it out. And if you go on the pill at that time, I just wonder about the long-term implications of that.
Totally.
There are other options as far as, things like the IUD. There's hormonal IUDs, which in theory are messing with your systemic hormones less than oral contraceptive. I don't know if that's actually been proven. There is quite a bit of circulation to the uterus itself, so I find it hard to believe that hormones aren't actually getting into the rest of your body, but that's just me being a skeptic. There's things like the copper IUD, which is not hormonal at all. It is a little bit bigger than hormonal IUDs. So some women do experience things like heavier bleeding or more cramping because there is this large metal object in their uterus. And when I say large, it's like, about this big, not very large, but it's a non-hormonal option. And some women do really, really well on the copper IUD. You can leave it in for 7 years. You don't have to take a pill every day. It's a great option.
Wow.
There's the implant that goes in your arm. It's a hormonal option as well. But, as far as non-hormonal options, there's not a lot of them. There is the mini pill, which is kind of a step down from regular birth control. It's a very, very low dose of hormones. Some people choose to go on that instead. There's now a vaginal gel that you can insert before intercourse to prevent pregnancy. I've had a couple patients ask me about that. It's non-hormonal, but it is acid-based and can throw off the pH of the vagina. So if you are prone to infections, that one is something to consider. I've had a lot of patients ask me about that who are coming off of birth control, and I think it's great in theory, but I find it hard to believe that it wouldn't cause you to get more infections, and yeast infections and UTIs are not fun to deal with to begin with. So if you add more fuel to that fire, that could be difficult. As far as fully non-hormonal options, there is, family planning or FIM method, tracking your cycles, tracking basal body temperature, cervical mucus. Personally, that's the method that I use and I have used for the last 4 years. I cycle tracking and condoms. I mean, people think condoms are the worst, but it's better than getting pregnant, in my opinion.
Totally.
So, once you kind of start learning the rhythms of your own body, you'll find out you can only really get pregnant one day of the month, but then a sperm can survive 5 days. So you have a window. And if you can nail down when you're ovulating through all those other methods, you can have a little bit more liberty with when you want to use a backup form of contraceptive.
Totally. And I can speak to that too, because I've been doing that for a year and a half now. And you guys, all transparency. I don't know if I've said this on here before, but like when I track my cycles and I know when I'm ovulating, and I would say I'm like definitely a little bit more careful. I do it with an app and it gives me my ovulation window. And I usually am like, I extend that ovulation window just a little bit before and after. But outside of that ovulation window, we are not like careful. And I'm fine. Like I haven't, it's been a year and a half and I haven't gotten pregnant. I think
Baby
there's,
trust.
yeah. It's just that there's people don't, I think that we don't get, and I didn't get this either, that we literally can only get pregnant one day of the month.
There's this huge misconception that you can get pregnant anytime, anywhere, any place, but like ask anybody who's trying to conceive, it's really not that easy.
No.
And unfortunately, it does happen unplanned for a lot of people,
Mhm.
but really the stars kind of have to align for between you and when you're having sex to be able to actually get pregnant.
Yeah.
So, if you're having consistent, regular cycles, then you can get into a point where you can start tracking your symptoms throughout the month. You can nail down a little bit closer of when you're actually ovulating and then choose, how you want to proceed. Like some people decide not to have any sex during ovulation.
Mhm.
Personally, I can't avoid having sex during ovulation because I want to have sex with everything.
Yeah.
That's just how it goes. But, some people choose to not partake in it. They do abstinence during that time. They do other forms of intimacy to fully avoid that risk. Some people use a backup barrier method, a female condom, a male condom, whatever that looks like for you. And then, once you're outside of that window, if your body, and there's a huge if your body is cycling regularly, you're ovulating regularly, then it's a very safe form of contraceptive to be tracking your cycles. But, huge but, you have to know your own body.
Right.
And that's the tough part is nobody teaches us how to know about our bodies. So then we're terrified of letting it do its own thing and the potential of getting pregnant. I just had to counsel a couple about this the other day. The woman really, really wants to get off birth control. She's miserable. And her male partner, is very scared and does not want her to come off of a pill. He's trying to support her with feeling better, but he's incredibly anxious about getting her pregnant. I'm like, okay, well, let's talk this through. Let's teach you, how to actually track this, get your partner involved so they can feel safer about what they're doing. Vasectomy is an option if you're not planning to have children. We seem to forget that that's an option. It's a very, very effective and minimally invasive procedure that most insurance companies will cover. So just putting a plug out there for that, because male birth control has been in the works for how many years and nothing has happened. So if we're waiting on that, we're going to be waiting a long time.
Yeah.
There are wearable devices. There's things like rings, bracelets that will track your basal body temperature for you. Apps galore. There's actually an FDA cleared thermometer, 2 on the market that I know of, Natural Cycle and Daisy.
Okay, I'm gonna link those in the show notes.
Yeah. I believe the Aura ring is something you can wear as well. There's so many options out there, and I could spend all day talking about them, but you don't have to be on birth control or on the IUD or anything like that to prevent pregnancy. You just have to be willing to learn about your body and be empowered by that information and take things into your own hands.
Right.
And you have to do that with the help of somebody who knows what they're talking about, or a book, or somebody that really can teach you how to do that.
Yeah. So let's go into that a little bit, because another thing that I feel like is not very talked about is all of the different phases that a female body goes through every month. We know about menstruation and sometimes ovulation, but I know that before I started studying the stuff and started my own journey, I didn't really understand that, like what ovulation was. I had heard the term, I knew nothing about it. But then I learned about these other phases, follicular, luteal, and I'm like, wait, what? What are these? So we used to cycle with the moon, yeah. And yeah, and my cycle is like almost synced up with them as well, which is really cool. So the moon has 4 phases and a woman has 4 phases every month, right? So do you agree with those 4 phases? The follicular, ovulation, luteal, menstrual, is that what you follow with your patients?
Yeah. So when I talk about a cycle, that is referring to day 1 of your period until the last day before your next period.
Okay.
So a cycle is typically between 20 and 40 days, and that will really depend on the woman. And as long as it's consistent for you within that time frame, that can be your normal, your regular. A 28-day cycle is like this made up illusion that like we have to be on a 28-day cycle. We have to ovulate on day 14. That doesn't happen for a lot of women. A lot of women ovulate on day 12 or day 20. You know, it just really depends. And that's why I want people to make sure they put in the work to learn their own body first, before relying on just an app as birth control, because apps are going off of algorithms. They're going off of what's most common, and they're predicting when you're ovulating. They're not actually telling you if your body is. So another caveat there. And I say all this to say that, you know, once you get into a groove of knowing your own body, it actually is very easy. But at first there's definitely a learning curve. And I always encourage backup protection while you're first getting stuff started.
Totally.
But, you know, day one of your cycle is day one of your period. Usually a period lasts from about 5 to 7 days long. You know, that's pretty typical. And then following menstruation or menses, that's the part of your cycle you're in, you go through your follicular phase. So what that means is part of your brain, your pituitary gland, is sending down signals to your ovaries to start maturing a follicle or an egg. So something called FSH, follicle stimulating hormone, starts getting secreted from the brain, talking to your ovaries. Again, this is not happening during birth control. This is happening in women without birth control. So they start talking, they start chatting, and egg starts maturing, usually one per cycle from your ovary. And then around ovulation day, we have a huge spike in testosterone to ramp up our sex drive and sometimes ramp up acne and fun mid-cycle symptoms. This, you know, ovulation can occur many different days. So I don't even want to give a range, but typically it's about a week after your period, a week to 10 days after your period ends. So we have huge surges in testosterone, and then we have something called luteinizing hormone, or LH, coming from the pituitary gland again, that kind of kicks that egg out from the ovary into the fallopian tube to travel down to the uterus to hopefully get impregnated. That is the main goal. Biologically, we are programmed to create life, and that's what the cycle purpose is. Regardless of if you want to get pregnant, that's what your reproductive system wants to do. So, you know, we have this huge surge in these hormones right around, you know, usually middle of cycle. If that egg does not get fertilized, then we go through to have the rest of our luteal phase. But our luteal phase is when kind of the shell around that egg that was created in the ovary secretes progesterone, our warm, fuzzy, happy, calm hormone throughout the rest of the month. And so we are kind of swimming in progesterone. And then if we don't get pregnant, the uterine lining will build up in preparation for pregnancy. But if we don't actually get pregnant, it will shed again the following month during our next period. So I think I got all of it, but cycle day one of your period, around day 3, 4, estrogen starts to rise. We start secreting hormones from the pituitary gland to start maturing an egg. Ovulation happens. So that's during our follicular phase. Ovulation happens. We're secreting testosterone and LH, kick an egg out. The shell, the corpus luteum starts creating progesterone. Then we're going through our luteal phase. And then if we don't fertilize, we're shedding that built up lining again and going back to our period. So all of those things are happening. It's honestly like this symphony of events. It's pretty fucking incredible if you think about it. Totally. Men don't got shit on us. Like they have some cyclical changes, but men just simply cannot understand the changes in hormones of someone that is identifying as female or has female anatomy. So it's a lot. And once you can kind of get down what that rhythm looks like for you, and coming off of the pill, it might be a little irregular for a while, but it will usually regulate itself out.
Yeah.
Figure out where you're at, and you can decide where you want to go from that with family planning or with using any wearable devices or anything like that.
That cycle is just so bizarre. I mean, there's so much power in our periods, truly.
It is. I think it's really, really cool, really interesting. I don't think there's anything gross about having a period. Like, it's completely natural, normal. Women have been doing it since the beginning of time. And it actually used to be a little bit more respected, women's moon time or their their menses used to be a time when they were actually like pampered and treated differently. And then we went through this period of history where, pregnancy was stigmatized, menses were stigmatized. Like you couldn't even talk to anyone while you were pregnant or while you were on your period. So it's definitely shifted away from that severe, but we still have this huge taboo about women's bodies, women's cycles. Like everybody on this planet was brought into the world by a woman. So why aren't we talking about how it happens?
Totally. And I mean, so in those 4 phases too, that, I mean, it happens like with your reproductive system, but that also affects like the brain functions as well, right?
Yeah. Yep. So we have those 2 major hormones coming from part of the brain, LH and FSH, talking to our ovaries. But estrogen, testosterone, and progesterone are 3 main sex hormones, all talk to our nervous system, all talk to our brain, all talk to our gut. They all interconnect. And if we try to take hormones away and make them operate in a vacuum, like a lot of people are just thinking about hormones, we're doing a disservice because your hormones impact almost every system in the body. I would argue every system in the body.
Wow. So tapping into our hormones with the female biology and like studying this stuff and looking into what all of this means to us is super important for our overall health and well-being, would you say?
Yeah, I agree. And even if you're not somebody that is cycling, if you are partners with somebody that's cycling, sisters with somebody that's cycling, friends with somebody that's cycling, you should know about it, because
Totally.
the more you learn about it, the more you can understand why a woman might be acting a certain way during part of her cycle. Like we do have, shifts in our mood, shifts in our productivity levels, shifts in our needs emotionally, sexually, like all of these things happen, and you can be a better partner, a better friend, a better coworker if you understand how this is happening.
Right. Well, and you just brought up 2 things that I think it's really also common is women shaming themselves for not feeling productive all month long.
Yeah.
And not feeling like going to the gym when they're on their periods. And maybe even for me personally, it's like a couple days before my period. I'm just like, I don't want to go work out. That sounds awful. Whereas in my like follicular and ovulation phases, I can't wait to get up and go work out. And
Yep.
I feel like a lot of women shame themselves for not feeling productive, not feeling motivated all month long, but that is just part of having the cycle.
Yeah, if we can start to understand again our own bodies and how they operate. So what you just brought up is actually called our infradian rhythm. So it's how our hormones relate to our sleep cycles, our mood, our digestion, our productivity levels. It's actually kind of a newer area of study. It used to be studied a lot and it kind of went underground. And now a lot of more people are talking about it, because there are times in your cycle when you're going to be feeling like a boss bitch. You're going to be making big moves, financially, in your work life. And then there's times where you're going to want to be a little bit more introspective. You're going to want to, maybe not be as social, maybe just, be with the people that you are really, really close knit with. There's going to be times when you don't want to go to the gym and lift super heavy. Like for me personally, I, for some reason, usually want to go to the gym, that tail end of my period. And that's when I've lifted the heaviest amount of weights, is when I'm like day like 3, 4, 5 in my period. That's because estrogen surges, around those days. So I'm like, hell yes, let's do it.
Yeah.
And then, through ovulation, testosterone's a little bit higher. So some women really do enjoy going to the gym during those times. They enjoy picking up weights. And then your luteal phase, you're kind of like swimming around in progesterone, which creates GABA in the brain, which is an inhibitory neurotransmitter that calms us down. So yoga might be more comfortable during those times. Sitting and meditating, going for a walk, like those might be the kinds of movements and activities you want during that time. So if I could put anything on a billboard, it would be listen to your body. And that principle applies everywhere.
Totally.
Don't feel like going to the gym because you're bleeding out of your vagina. Don't go.
Yeah, right. Totally.
Nobody's there to tell you you have to. You're just
So
shitting
good.
all over yourself.
Yeah, so good. And okay, so I want to get into the sex thing a little bit because one of one of my favorite posts on your page is the one where you were like, here's my favorite health boosting tips, have more orgasms.
I thought you were going to ask for the WAP post.
I don't think I've seen that one, but I'm going to have to go creep because that sounds intriguing.
It's all about WAP.
Love it. So why orgasms?
Why not? That's the question.
I
No.
love it.
I mean, orgasms have the ability to bring us closer to our partner, bring us closer to ourselves, clear up our skin, regulate our hormones, create a good mood, like make us more productive. There are so many benefits of regular orgasms. And it should be said, your body does not discriminate on an orgasm that's given to you by a partner, by a vibrator, by your hand. It does not care. So that being said, regular orgasms are definitely something I recommend to my female and male patients, and just because of the the wide ranging health effects.
Yeah.
You're just gonna feel better. You're going to feel better mentally. Some people claim they're more productive. It helps us lower cortisol, our stress hormone, helps boost oxytocin, our like very warm and fuzzy cuddly hormone that gets secreted when we're when we're going through childbirth, when we're breastfeeding, or when we're hugging skin to skin, or when we're orgasming. We release oxytocin, and it is a damn good hormone. We want more of it.
Love it.
We're not getting enough of it in this world. So yes, that's my soapbox. I'll get off of it. But orgasms for a lot of people are not attainable with where they're at right now, where they're at with their understanding of their body. So I'm just a huge advocate for people learning what they actually like, with themselves first, if that feels safer, and then learning how to communicate that to a partner if you are going to engage in partnered sex. Because if you don't know how you want to have sex, your partner has no shot in hell in knowing how you want to have sex. And if you don't like the body you're having sex in, you're not going to enjoy sex. If you have previous experiences of trauma or negative associations with sex, you're going to have a harder time having an orgasm. So that needs to get out of the way too. That's a huge thing that I see. I've happened to me in my personal life. I had a lot of issues surrounding my view of sex, had traumatic experiences, and didn't orgasm until I was like 24 years old. And I didn't even know it. I was just like, okay, sex is fine. You have to go through a journey. Unfortunately, sex just doesn't come easy for a lot of people, and there's a lot of shame in learning how our bodies work, and I'm trying to get rid of that one by one.
I love it. Yeah, I don't think it's ironic that with my journey, so it was like a year and a half that I was single through missing period and the acne and all of the gut and hormone things. And I was like, of course, doing other things, like focusing on healing the gut and doing all like working with my phases, learning my body. But then I started dating Zach, and I got my period back after 2 years, like 2.5, 3 months into dating him. And it was like the first time I was having consistent sex in a long time, like since coming off the pill. I mean, yeah, it had been a long time. So I don't think it's ironic that I happened to be having consistent sex, and then my period came back, and a little bit later, like a couple months after that, my skin started to clear. I mean, of course, it all goes hand in hand. Like I said, there was other things that I was doing, but I feel everything that you just said. I feel that with the orgasms. And I just think it's another thing that I don't think I know. It's another thing that it's just not talked about enough. And there's a lot of shame around sex and orgasms. And like you said, like a lot of struggle. So I'm really glad that there are people like you out there normalizing it and educating us on the fact that it gets to be a normal, fun thing for us to do.
Yeah, it's fun.
Yeah. And
I
it gets
mean,
to promote our health and well-being. Like, how cool.
yeah, it's a little side benefit.
Yeah.
Well, I definitely don't think it's a coincidence that that was when your period returned as well. There's definitely some hormonal shifts that we go through when we're regularly having sex, and if you're regularly having orgasms. So that to me is not surprising. I will also say the reproductive tract in females especially is very prone to holding on to emotions and holding on to trauma. And you can think I'm a crazy person for saying that I don't care. I have just seen it too much in clinical practice and too much in my own body and the people that I care about.
Totally.
That we hold on to a lot in those tissues. And, until we can really sort those out, whether that's finally, feeling you're in a safe relationship with somebody, or you're in a different relationship sexually, like those things can really be a catalyst for getting your hormones back on track too.
So good. So what are a couple of things that our listeners, like if you had to recommend 3 of the best like overarching hormone practices, if you can, like what are some things that our listeners could start doing today, whether they're on the pill, not on the pill, struggling with a hormone imbalance, not struggling with a hormone imbalance, whether they're whatever, like maybe they are, but they don't know it yet. Like what are some things that people could start doing to enhance their hormone health?
Yeah, that's a great question. It's hard to narrow it down to just a couple because obviously, these depend on what your concerns are and, your own picture of hormonal health. But I will say my number one is pooping.
Yeah.
It's not sexy. Nobody likes to talk about it. But whether you're on synthetic hormones or you're letting your body make its own hormones, the only way we get rid of them is through detoxification and digestion. So if you are not having at least one bowel movement a day, you got to get that going, girlfriend.
Yeah.
So, ideally, as a mammal, we should be having a bowel movement after every meal that we eat, just like a dog or a cat.
Yep.
But most people train ourselves out of that. So if you need to add more fiber to your diet, if you need to start moving more, you need to start drinking more water, you need to do something like magnesium, whatever that looks like for you to get things moving. That's my number one.
So good.
Number two, I probably should have made number two pooping, but whatever. Number two would be consuming foods that have hormonal benefit, namely leafy greens and cruciferous vegetables. So leafy greens would be like spinach, kale, arugula, chard, collard greens. Cruciferous veggies are things that look like little trees. So Brussels sprouts, broccoli, cabbage, those things can contain 2 compounds, indole-3-carbinol and DIM, that help us actually detoxify and metabolize our hormones properly. So whether you're trying to metabolize or detoxify synthetic or bioidentical hormones or whatever it might look like, you need those compounds. Some people take them in supplement form. Some people do them in powder form. I think powdered broccoli tastes disgusting, but if that's your jam, go for it. I just encourage people to get things through food whenever possible. And number 3 would probably be a stress management practice or a mindfulness practice, because if you are living in a state of chronic stress, your adrenal glands are not going to be keeping up, your thyroid is going to be out of whack, and we have kind of this axis, a little triangle between our ovaries, our adrenal gland, and our thyroid. And if any of those is out of whack, the others will compensate. So if you're living in a state of chronic stress, your adrenal glands are going to be, burning the candle at both ends, and your thyroid and your ovaries have to keep up. So we tend to overcompensate. So, if you're continually stressed out, you need to find something that works for you, whether that's a movement practice, journaling, meditating, walking out in nature, having sex, like whatever that looks like for you. A consistent stress management practice is absolutely key for healthy hormones. And those are all things that you can do on your own without my help. Totally. If you need, if people need additional help, there's, there's supplements, there's botanical medicine, there's prescriptions if you need it. Like there are other ways, but there's so much that can be done that you have power over. As far as hormones go.
So good. Thank you for those tips. Those are amazing. So where would somebody start? Like if they want to start exploring this, I know that you have a reel or multiple reels talking about different tests that you can take to test your hormones. Is that where, like, if somebody right now is like, okay, I'm resonating with what they're saying, I'm definitely experiencing some of these symptoms, would you recommend that they just go right into testing or like find a doctor like you, or where would somebody start to like tackle these issues that they're handling or dealing with?
So I'm a little biased, and obviously I would encourage people to work with a provider that they trust who knows how hormones work.
Totally.
But testing is not always the first place that I go. I tend to consider myself a very functional practitioner. I love looking at labs. I love the data, but it's not always the right decision for where a woman's at. If you're on the pill, testing your hormones doesn't make a whole lot of sense. If you're just coming off of the pill, sometimes it doesn't make a lot of sense. If you're, just had a pregnancy or just breastfeeding, like those are times when it doesn't make sense either. So, sometimes based on clinical picture, there's a lot that can be done without testing. But if you're a data person, you love seeing that, you want to track things over time, testing is a great place to start. Sometimes you do have to see a provider to actually get the labs done. I know there are companies that do direct to consumer labs, like I know Everlywell does hormone panels. I have interpreted those for people before and they seem okay. I don't know the validity of, what they're actually doing though. So it's hard to say with things that are sent directly to the consumer, but in my experience in using, in people using those kinds of tests, they have been fairly helpful and they were able to get them without a doctor's note. You can go to your OBGYN and ask for testing. Sometimes they might look at you a little funny because they don't test hormones all that often, which is crazy to me. But if you advocate for yourself, if you go in and you know what you want, you can ask for it.
Yeah.
I usually recommend looking at people either on Instagram or their websites, or I know even people are on TikTok. I'm not on TikTok, but I know a lot of people get their health advice from there. But there are doctors out there that are putting information out, like Dr. Jolene Brighton is one of my favorites. She's very accessible, has a ton of information.
Yeah.
But it's meant to go to the general population, so it can be overwhelming. People, I love her book Beyond the Pill, but people come in and they've read it and they're overwhelmed. So that's a good place to start, but sometimes you need to have a little bit of help kind of honing in on what you actually need,
right?
Or versus you might not need everything that's in that book or on that blog or whatever it looks like.
Another good one is, are you a follower or a fan of Elisa Vitti?
I feel like I follow her, but
So she wrote Woman Code, and then she wrote In the Flow, which
I have read In the Flow.
Okay, yeah. In the Flow is a really good resource to start, but I would agree with you. So for those of you listening, and I think that I've probably said this, but I tried to do this on my own for a long time. And I was studying to become a holistic health coach when I first ran into these issues of the missing period and the hormonal acne. And I read all the books, I listened to all the podcasts, I did all the things, and nothing really fully changed. A lot of the stuff helped, but I didn't get my period back and fully clear my skin until I started working with a functional medicine doctor. So definitely, you guys, just start exploring all of this stuff. I mean, Dr. Jenny gave you so much good wisdom. Follow her on Instagram. We'll give you guys her Instagram handle in a moment. But Dr. Jen, is there anything else that you want to share with our listeners that you feel called to share with them on any of these topics?
Well, I will just echo on the fact that you can start a lot of things on your own. You can start reading, you can start looking into resources, you can start tracking your period, even if you're on the pill, just to get in the groove of tracking symptoms. There's a lot that you can do to prepare yourself. And sometimes people don't need to see a provider, but if you're feeling stuck or you've hit a plateau or you're just overwhelmed, find somebody who can help you, whether that's a health coach who focuses on hormones, or even so far as a naturopathic doctor or a functional medicine doctor. You just have to find what works for you. But last minute wisdom: have more orgasms. They're good for you. Learn how your body likes to orgasm in the first place. Get comfortable with thinking about your body as a sexual being. Get comfortable with learning about why you have certain thoughts about sex and why you have certain thoughts about your period, or why you think these things are taboo. Do you actually think they are, or did somebody tell you they are? The best part of being a human is that we can decide any day, what we want to believe or what we want to, see as our truth. So if you're like, oh, maybe I have been thinking about things wrong this entire time, or I've been thinking about things a certain way, there's always time to change the way that you view a situation. There's always resources. There's always people that will talk about this kind of stuff. You just have to find them.
So true. I love it. All right, let's do some rapid fire questions so our listeners can get to know you a little bit more. So first one is, do you have a morning routine? And if so, what does it look like?
Yes. It's not incredibly structured, but wake up, obviously. Usually drink a glass of water and then wash my face, do my little skincare routine, poop, sometimes go outside and get some sunshine. I will say I'm not as great with that one. And then meditating. I usually meditate for at least 15 minutes, sometimes, up to an hour if I have that time available to me. I will say I am somebody who likes to sleep in as much as possible. So I sleep in to the point that I can still do my morning routine and also, get more sleep. So after I meditate, I usually will drink some coffee, although I'm trying to push that back to 2 hours after I wake up now. So that's been a new thing. And yeah, that's the most consistent. Sometimes there's some journaling thrown in there. Sometimes there's a walk, but most consistently, get up, skincare, poop, meditate.
Love it. So what is your, like with meditation, do you do silent meditations? Do you do guided meditations? What are your faves?
So I enjoy guided meditations a lot. I work with those quite a bit. Sometimes I'll do even something like a candle staring meditation. I know it sounds crazy, but literally just looking at a candle and zoning out. Sometimes I'll just listen to music. Because of my living situation, like we're in a house and there's other people in other units, like I don't really like silent.
Mm-hmm.
But if I'm out in nature or I'm, out somewhere else, I'll do a silent meditation. But
Do you have any favorite guided? Do you have any favorite people who record meditations that you love?
so my life coach, gotta shout him out, Trevor Higley. I am currently doing his subscription that involves like one-on-one coaching and meditation and group stuff.
Cool.
For a while, I worked specifically with him for the last year, and it was a game changer. But he has really brought me a long ways in my meditation practice, and he has really big resources for meditation on his website.
Cool.
And I think right now you can get a month free from his meditation subscription. So check him out.
Yeah. Okay. Good. That's what I was looking for. Sweet. So what is a practice that you do to get back into alignment? So let's say like you wake up, you do your morning routine, you're feeling great, you go to work, and then like you're just feeling blah. Is there any like little practices that you like to do to like feel more like yourself or feel more in alignment or in that high vibe state again?
Usually going for a walk will be a great way for me to kind of shift out of a mindset that's not great or not productive. So going for a walk has been a big one for me lately. Listening to music has always been incredibly powerful for me. Like music will bring me to tears more than anything else. So, I'll pop in my favorite song, I'll sing, I'll dance, I'll masturbate if I need to, like,
Love
hey,
it.
if I'm in the space where I can do that, obviously not at work.
Right.
But if I'm feeling funky, like really just taking time to connect to yourself, and like masturbating is an amazing way to connect to yourself and just give yourself some love, like, or even dancing to your favorite song. Like that's a form of self-love. So it's really something to usually get me back into my body, because I tend to go up into my head quite a bit if I'm having a bad day.
So good. Do you cook? Do you like to cook?
Yes.
Okay.
I love to cook. I have a boyfriend who eats like a 400-pound man, so it doesn't look like one, but so I usually do a lot of meal prepping. We are both incredibly busy, so I usually will do a big like 2-hour meal prep on Sundays, get all of our food, mostly lunches and dinners, ready for the week. And then I really do enjoy like slowing down and cooking a meal, but that doesn't happen that often except for like breakfast on the weekends.
Yeah.
But yeah, I tend to cook fairly healthy. I grew up in a home with my mom and dad are both really good cooks, and ideally like too good at baking. So I try not to do too much of that, but
yeah. Okay. So that's great. I want to know, what do you typically meal prep? And then if you do have time to slow down and cook a meal, what's your favorite meal to cook?
ooh, that's a great question. Usually I will meal prep. So again, I'm feeding an army in my home. So usually there will be some form of, usually 2 different types of protein. Like I'll cook up a big batch of salmon or chicken or ground beef or ground turkey. And then, some form of starch. So rice, quinoa, sweet potatoes, regular potatoes, whatever that looks like. And then roast 1,000 vegetables, like fill my entire oven with pans of veggies that are different seasonings, different flavors. And then sometimes I'll prep breakfast stuff too, like an egg bake or like oatmeal. I tend to eat a little bit less meat than my boyfriend does. So sometimes I'll have, just a vegetarian option for myself, like lentils, tofu, something like that. My digestion just tends to agree a little bit better with a more plant-based diet.
Yeah.
I will say I kind of don't get the most exciting with my meal preps though.
Yeah.
They're very utilitarian, which is fine for me,
Totally.
because when I do make food, I can make something I really like. So
Right.
sometimes that would look like a bonza pasta, like the chickpea pasta with like an Alfredo sauce made with like cauliflower and nutritional yeast or whatever. Or like a lasagna. Like usually if I'm gonna cook, it's like I'm going all out and I'm getting something that I don't usually make.
Yeah.
And I usually put a healthy spin on most things. Like I don't eat a lot of gluten. I don't eat a lot of dairy just because that works better for me. But
right.
Or breakfast for dinner, breakfast anytime. Breakfast is my favorite thing ever. My boyfriend used to work at Waffle House, so he's like loves cooking breakfast. So we're all about it.
What's your favorite breakfast to cook or to eat?
Some like over medium eggs, some sourdough toast, Geta. It's a Cincinnati thing. That's where it's from. It's a form of sausage. It's delicious.
Oh my gosh.
I'll do that sometimes, or like bacon, but not often. Or pancakes.
Yum.
All the things.
So good. Do you ever share any of your cooking on Instagram?
I do sometimes. Honestly, I'm not that great with like making things look aesthetically pleasing while I'm cooking. Like they look good when they turn out, but like I'm not the person to like set out all my ingredients and like make a little reel. I could, but I just don't.
Hormone healthy meals is something that like I'm always searching for. I have a good friend who's really big into, I mean, she doesn't like teach in this area, but she had a really like wild hormone journey and healed her hormones holistically as well, with help, of course. And her husband is a good cook, and she's teaching him about like all the different foods that support each phase of your hormonal cycle. And so he's working on a cookbook right now that's
awesome.
I know. And I can't wait. I'm always like, give me the hormone healthy meals. I need ideas. So
yeah, that's so cool. I do say I used to share a little bit more about like my grocery shopping and like meal planning and stuff, but I don't know. I kind of shifted away from that. I started shifting towards more like body positivity, sexual wellness, like period stuff, because it just started resonating with me a little bit more. But food is always the backbone of all of that.
Love it. All right. So last rapid fire question is, where's the best place you've ever traveled to?
Ooh. Well, I will say my favorite place is in Pentwater, Michigan. It's like this little beach town. I think it's north of Ludington. It's just a really special place. My mom and dad met there. Like I've been going there since I was a little kid. So I love it there. But probably the most exciting place I ever traveled, or the best trip, was to Greece. I went there for 2 weeks during college, and it was incredible. And I want to go back.
What islands did you go to?
So we stayed on the mainland most of the time. Okay. So we did Athens, we did Delphi, we did a little town called Nafplio. That is probably my favorite place I ever went, was Nafplio. It was like where they told us it's where the Greek people go to vacation because it's not touristy at all. But we did go to one island. I think it was called Agina, which was beautiful as well.
Okay, cool. Oh, I love Greece.
I know, it's beautiful. The food there is just chef's kiss.
We actually have some listeners who live there. So shout out to you guys.
Shout out. Your home is beautiful. I want to go back.
All right. So good. Dr. Jenny, thank you so much for coming on. Where can our listeners find you? Where can they get more of your goodness and your wisdom? Where can they connect with you and work with you?
Yeah, I would say the best place to reach out is on Instagram. So docjenb_ND. I love responding to DMs. If you find a post that you like, you want to learn more about things, like I'm open to any topics. That would be the best place. Facebook as well, Dr. Jennifer Buchner. Those are probably the two easiest places to find me.
Cool.
I'm always fun to chat.
Awesome. We will link both of those in the show notes. So for the millionth time, thank you for coming on. This conversation is so needed. Our listeners haven't had anything like this yet on this show, so I know that they gained so much from it. So we just really appreciate you taking the time to be here with us today.
Yeah, of course. Thanks so much for having me. I love talking about this stuff, so anytime.
Of course. All right, guys, go follow her, and we'll talk to you all next week. Bye.